She's getting better, hon. She went yesterday and got tested.
Oh, good.
Yeah, she's fighting it. So she was like, "That's it. I'm going to get tested again." It's been 12 days. I was like, "Oh my God."
How's
So
she feel?
horrible. She said she still feels weak. She still has headaches. She still has diarrhea, whatever, and her body still hurts. But she said she's not gonna let it get her down.
She's eating and everything?
Yes, ma'am. And she
Good.
said she vomits every time she does, but at least she trying.
Yeah. Maybe some Zofran might be helpful.
Yeah, I told the doctor about the Zofran, and I also told her about the I can't even pronounce it, but the doctor won't give it to her because they said it's a hospital medication that they're giving COVID patients, and it can only be given in the hospital. It begins to, yeah, that's it.
Oh, that's the same thing.
Huh?
Ondansetron?
No. Reservamir.
Oh, okay. Okay.
Yeah.
They couldn't give her the hydrochlorozine or with the zinc
Hydroxychloroquine?
Yeah, hydrochloroquine with the zinc and the
Z-Pack?
Z-Pack. They wouldn't do that either.
They could do the Z-Pack, but they wouldn't do the other two drugs because they said she need to go to the hospital. I was like, "You so full of it." I think her doctor just timid.
They're afraid to use the hydrochloroquine.
Yeah.
She's
Anyway, well, good morning. It is 7 a.m. It is nursing 1640. It's a clinical day. It's a 12-hour day. I am going to start off, if everybody is here, if you could just put hi in the chat box for me, just to let me know you're all here. And I am going to pull up Canvas.
Okay. Oh, them braids still look bright, Miss Caitlin.
Okay. So let me. All right. So today I'm going to share my screen in a second. Before I get started on all of that, have you looked at the announcements? I put 2 announcements up yesterday regarding Thursday's exam. How many of you have done a proctored exam from home?
We all have. Yeah.
I think we all have. Yeah.
Not necessarily. The re-entry people may not have done. So Kaylin has not.
I haven't.
Right, Kaylin has not. Have you, Elisa?
No.
Okay, so Elisa and Kaylin, you have to look at the announcement today. There's 2. You have to read them in their entirety to understand what I'm talking about, okay? So that's something you need to do this morning and get it done. Your phones, do all of you have a phone? Okay, do all of you have your Teams app on the phone?
Yeah.
Okay, have all of you used your Team app on the phone or accessed it to see if it works? Good, because you're going to need that on Thursday. So the concept on Thursday is as such. We meet, you open up your laptops. I don't know if all of you have cameras on your laptop or not, but regardless, you're going to use your phone and you're going to get on Teams on your phone. And I presume this is how you did it. Is this how you did it with Miss White or wherever you did it before, guys? Yeah?
Yes.
So you got on Teams and you showed me on that camera your desk, the surroundings, the room, made sure there's nobody behind your laptop that's feeding you the answers, all of that type of thing. And then you put your phone somewhere that I can see your keyboard. Okay, so you might want to think about how you want to set that up. but it's got to be so that I can see what you're doing on your keyboard. Okay, so I'm not sure how you did it last time, but I presume it's something along those lines. Okay, so that's what needs to happen for Thursday. The reason I'm talking about it now is to give you 2 days to get that organized so that Thursday you can open the exam and you can hit the ground running and we can get it done. All right?
And this is over everything that we've done thus far.
No, just week 2.
Oh. Okay.
Just week 2. Okay?
We
So
can't hear you.
it'll be 50 questions. A lot of it is
50.
going to be ABGs. There'll be 5 dosage calc, and I'm going to go over a little bit of dosage calc today, of course, a bit later today. It is going to be over, and I'll pull it up and just sort of go through some pieces with you, but it's going to be on the topics that we discussed last week. All right, so that narrows it down a lot for you. Okay, so that's so I really suggest that you look at those announcements, even if you've done it before, because there may be nuances, there may be slight differences. There are 2 PDFs for you to look at so that you understand the expectations for the exam, and also look at it to understand what your desk needs. You may need a whiteboard. You may need a calculator of some description, those types of things. And I doubt if you can do it all in your head. So you know, if you don't have a calculator, you might want one. But definitely a whiteboard would be a good idea. I don't know if they allowed you to use a piece of paper last time, but from what I understand, it was a whiteboard that you then wipe clean at the end of the exam. So please look at that information, and we can talk about it a bit later if you've got questions about all of that. All right, what else did I want to go over? So this week we are looking at chapters 14, 15, 16, 17, and 25. That's what we're going to go over on Thursday in the lecture time after the exam. So today, what I've done is put you in groups of 2. So I'm going to go to people right now. And let me share my screen. Hopefully. Okay. People. Wow, my computer is so slow. Come on. Okay. All right, what happened there? Maybe it's this one. Okay. All right, so I'm sorry, guys. So the one that says groups of 2, duh. So you would think that was pretty self-explanatory for me. But anyway, here we go. So we've got groups of 2 going on here. All right. So these are your groups of 2 that I want you to be aware of, and you can just go there and look. You won't be doing that until this afternoon. This morning you are working individually, and I'm going to show you what we've got going on. This is this morning's clinical work. Okay, so the first thing you're going to do, like last week, you have some clinical skills. And the reason I'm using these clinical skills is it's actually part of your assignments anyway, that don't get graded. But I thought it would be helpful to all be on the same page and do some of these assignments. So as you can see, I know some of these links don't work, but at least you know what you're going to be doing. So we have a few assignments here for you to do. And then what I have here is a small case study with some questions. And I need you to put the answers, you can put them on a piece of paper, and also a concept map. And it's predominantly related to chapter 16 in your book, okay? And chapter 16 is about post-op care. So this will help guide you regarding some post-op care information, all right? That is your morning work individually. Any questions on that so far?
So the case study, we do our own, I can't even spit it out.
It's all individual this morning.
Okay.
Your
So
concept
another
map,
PowerPoint and a concept map. Okay.
you can do it however you want to do it. That's your choice. You can do it on a what do I mean, Word doc, whatever you prefer to do. If you want to do it on PowerPoint, you can. So however you want to do it. And then your afternoon work, so that you can plan, is this. This is groups of 2. You will upload it and you will do a peer review.
I can't see it.
So this is going to do with pressure sores. Now, I'm going to presume most of you know what a pressure sore is, but maybe you don't. So does anybody, first of all, not know what a pressure sore is or what that means? Anybody? No. You all know. Okay. So what I'm asking you to do, again, you can look in your books. It is chapter 25 in your books. There's a lot of information about the Braden scale, about what pressure sores look like and pressure ulcers. So this particular patient starts out with a stage 2 pressure ulcer and then develops, all right? So what I'm asking you to do is look at the case study, answer the questions, look to see what that stage is as it develops, and also calculate the Braden score that could have maybe prevented all of this in the first place. The other thing I'm asking you to do is look at the fact that this patient, if a patient has a skin infection, what would be the steps to prevent transmission? So I'm talking about PPE, I'm talking about understanding the fact that this patient has, where is it? MRSA, growing from the hip. All right, so what does that mean if somebody's got a staph infection, a wound staph infection? How do you prevent transference to other patients, of course to yourself, to anyone else? How would you care for that patient? What education are you going to do? All sorts of things like that, okay? In your groups of 2, I want a care plan, please, related to the patient's skin issue and their nursing care. All right. The expectation is to have this done by 5 p.m. I didn't put that on there, but I can stick that on there. By 5 p.m. That gives you plenty of time to get that done. Any questions on that so far? Pretty straight.
What's the middle break?
Beg your pardon?
What time do we come back from the morning?
I'm gonna say 1. You know what? Evelyn, you and I were gonna meet at 12:30, correct? Today? Okay. 1, 2. Yeah, let's say 1. But you know, you can start working on your other project before. You can start working on your the afternoon project earlier So might be an idea. Now, what I am going to do a little bit of today is probably, let me just look at something here, try and plan for you a little bit.
So we're doing a video on this stuff for the skills for the AM clinical work.
No, they're clinical skills that you did just like last week. They're clinical skills. You go through the pieces and you answer the questions. They have little videos in them.
Mm-hmm.
You did
Okay.
them last week, right?
Yes, ma'am. I'm just trying to figure out. Yeah.
Yeah, so same concept as last week. Okay. And basically you can take a picture of the end of it. I think you can take a picture of like of all of them together basically, and then just send me that of what you've done. Now, what else did I want to say? And then just take a picture of your concept map and send me that too. Yeah, and upload that, please. So those two things you're going to do and upload them. Lunchtime at 1 o'clock. I think what I'll do is go over some of the dosage calc questions that are going to be relevant to your exam. And let me just have a look what I want to do with those. I think one of them is I want to do a drops per minute. I want to do a mils per hour and a microgram per kilogram per minute. So I have a few of those that I want to do with you at 1, a few of those. And maybe what I'll do is I will look, if you've uploaded your clinical work by that time, the morning work, then, you know, I can have a look at some of those. If you haven't, that's fine. You've got till the end of the day to upload all of that work, okay? Because it's individual, so it might take you a bit longer. So what I'm saying is I'm not going to get you to present at lunchtime. So that's partly what I have for you. Now, I just want you to be aware, guys, your HESI at the end, you know, your final HESI, some of the questions that were asked were things like pressure ulcers and MRSA, which is why I'm honing in on that right now. Braden score was another thing that was honed in on. So you can see why I want to do those things right now for you. There was a question on microgram per kilogram per milligram per mil, a milligram per mil, apparently, one of your dosage calcs. So again, that's why I want to sort of go over some of these pieces with you. Let's see, what else? I think that's it. There's even a question on hand washing. So you can see why contact precautions and making sure we've got good hand washing is important. So let me see if there's anything else that that I feel that you need to know. Anything that you've got concerns about, or anything that you want to bring up this morning? Confusion, the HESI stuff?
My only question is about the remediation. Did they come up with any kind of conclusion on that?
It's quite honestly, it's very vague.
Okay.
Now, hang on. Because it's vague and because there aren't any hard, like it's either a 0 for this, or I have already said I'm giving you guys 5%. Okay, basically you did the work. Now, Kaylin and Elisa, it's different for you two because you're re-entry. So I know you guys didn't have remediation. So therefore, you know, that this doesn't apply to you guys. I think from what I understand, this is the first time it's really been graded. And so because of that, and because it doesn't really delineate, in my mind, it doesn't say, okay, if you didn't get 78%, well, what then? You know, what are the steps? What does that mean? I don't feel that I can truly turn around and say, well, you can't get this or you can't get that because you did the work. Now, what I do want to bring out in that is, and this applies to you and Elisa and Kaylin too, I want you to understand that this remediation, yes, it's a checkbox, yes, it's a pain, and all of those things, but ultimately what they're trying to do is train your brain so that you start doing the prep work on areas that you're not as strong, so that you can really get it in your mind down the road for your NCLEX and for your finals. So the reason I'm telling you this is when you come to your practice HESI on week 8, and there will be remediation, I really want you to focus on getting that 78% or above on your remediations, okay? So because although it's on the syllabus, the only mandate is if you don't do any work, you get a 0. They want you to get 78. That is the standard. But I can't really, I don't feel that I can ding you and say you can't get this amount or that amount when I don't have any specifics to go on. So I don't really feel that that's fair to you. Does that make sense?
Yes.
Yeah. Yeah. My suggestion is if you've got recommended packets, especially in pharmacology, because you guys did great in PharMs, but I really suggest that in Pharm, you guys look at the recommended packets. And Rhonda, I really think you need to look at your recommended packets as well regarding the 1640, okay? So I would just make that as a suggestion. The other things that I've suggested is get your NCLEX books. As Evelyn does, she does 10 questions a day. I understand that everybody can't do 10 questions a day. I will incorporate some questions as I'm teaching, as I did last week in the lecture from your NCLEX book, and I'll do the same this week, and I'll continue to do that. But I would suggest that you start really incorporating those things too. Anything that I put in the modules for you to look at as a suggestion, I would look at it. The ABG practice that's up there for you, do it. This week, as just a thing that I've put in there, is to do with burns. Now, last term, I actually put a burns case study up. I haven't done that this week because looking at what your last HESI did, it didn't talk about burns. However, what I want you to be aware of, and it's not actually part of your syllabus, so, but this right here, rule of nines and Parkland formula, is something for you to be aware of. Has anybody ever heard of the rule of nines? Okay, it's to do with children's is slightly different. This is an adult rule of nines. Children are slightly different. But basically what it's looking at is where the patient has been burnt and how much of that surface area of the patient that has been burnt determines potentially their obviously how severe it is, but also maybe what their life expectancy is going to be as well. So it sort of gives a really good idea of how with that patient. So as I say, that isn't part of this syllabus. However, where I remember the students coming out of a HESI fairly early on and saying, oh my gosh, there was a question on the Parkland formula and they had never even heard of it. So I'm just saying it's there just in case, all right, for you to understand the concept, even if it's not even on the syllabus. All right. Okay, so I put it up there for you. Okay. So this week to me is an interesting week. That Thursday, as I say, you'll have the exam. It's 50 questions. You'll have 100 minutes to do the questions, 2 minutes a question. And then, as I say, we'll spend the rest of the class on Thursday doing lecture time. All right. Any questions or concerns? No? All right. I will have my phone with me if you need me for anything. I didn't hear whether it was going to be this week that Miss Smith was going to be working with us on test questions. It might be next week. However, next week, remember on Wednesday, we will be in lab. That's my goal, for you guys to actually be on campus in lab, in uniform, in case anybody wondered. All right. Okay. I will talk.
Alyssa, I haven't been with you. How do you want to communicate?
We could do it on Teams if you want.
Okay. What team do you want? What do we have choices? Do we have just 1 and 2?
Yeah, just 1 and 2.
Okay. So you want to go on 1 if anybody cares? Can we have 1?
Yeah, whichever one's free, we can do that one. That's fine.
Kaylin,
Okay.
FaceTime. Bet.
Alyssa, you want to meet like 10?
Yeah, that's fine.
Okay.
Rhonda,
Yes,
please.
ma'am.
Okay, make sure you, are you with Amber today? This afternoon?
Yeah.
Okay. Make sure you're available, please. Okay. Mimi, who are you with today?
Me and Kaylin already got it figured out.
You've already got it figured out.
Yes,
Do you
ma'am.
have it figured out, Rhonda, with Amber, how you're going to communicate?
Yeah, we could do Teams too.
Okay.
Okay. You might want to do that first thing so you have it, all organized for the day. Okay. All right,
All right,
ladies.
Alyssa, I'll meet
You
at
have
10.
okay.
Trying
And
to miss her.
we're gonna meet up at 12:30. But obviously, if anybody needs to speak to me beforehand, just contact. I don't know who it was who texted me earlier. It didn't say name, but somebody asked me about the exam.
I did. I texted you earlier.
Who?
I did, Rhonda.
Oh, Rhonda. Okay. So yes, it's going to be on week 2 is what you're being tested on.
Oh,
All
okay.
right. Thank you, ladies.
Thank you.
Bye-bye.